Now, neural tube defect over, neuronal migration defect over, hydrocephalus associated syndrome, Arnold-Chiari type 1, Dandy-Walker or over, seizure over. In seizure, we read in detail what is focal seizure, what is generalized seizure. Focal with awareness, focal without awareness. Without awareness, automatism and aura. Generalized seizure, most important, absence seizure, 9 points we have read perfectly. Then about febrile seizure, simple febrile, complex febrile, drug of choice, paracetamol for prevention, paracetamol plus clobazam. Now come to neurocutaneous syndrome. Now in today's era, more concern or integrated question. Integrated means a question with need of various subjects. Neurocutaneous syndrome is a topic you read in pediatrics, in skin, in medicine. Okay, integrated. So skin, neurocutaneous. There are few cutaneous signs with few classical neurological finding make the diagnosis of neurocutaneous syndrome. Trust me, these are very important. Invariably, you find question in exam whether in the skin section or medicine section or pediatric section. Neurocutaneous syndrome, and it will take only 15 minutes to remember all neurocutaneous syndrome. Neurofibromatosis, tuberous sclerosis, Sturge-Weber syndrome, von Hippel-Lindau disease. One by one, neurocutaneous syndrome. Neurocutaneous syndrome. There are 7 features of neurocutaneous syndrome, 7 features, and it's autosomal dominant condition. It's autosomal dominant condition. Autosomal dominant condition. Number 1, Cafulet spot. Cafulet spot. Prepubertal 5 mm and postpubertal 15 mm. Cafulet spot. Cafulet spot. It present in 100% patient. It is the hallmark of neurofibromatosis. Cafulet spot. Axillary or inguinal freckling. Axillary or inguinal freckling. Leash nodule. Prevalence increase with the age. Prevalence increase with the age. You hardly find any leash nodule below 3 years, but 30 years, most of the patient have leash nodule. 2 or more plexiform neuroma, thickened nerve, optic glioma, osseous lesion, scoliosis, pseudoarthrosis, sphenoid dysplasia, and family history present. These are the 7 points of neurofibromatosis. These are the 7 points of neurofibromatosis. 7 points. Cafulet spot, axillary freckling, leash nodule, plexiform neuroma, optic glioma, osseous lesion in the form of scoliosis, pseudoarthrosis, sphenoid dysplasia, family history present. To make the diagnosis of neurofibromatosis, we need only 2 points out of 7. One is always Cafulet spot. You can't make the diagnosis of neurofibromatosis without Cafulet spot. One is always Cafulet spot. So you need 2 points out of 7. One is always Cafulet spot. Suppose child is having Cafulet spot, father is a known case of neurofibromatosis. It's neurofibromatosis. 2 points are there. Child is having Cafulet spot and scoliosis. Child is having Cafulet spot and optic glioma. It's neurofibromatosis. So these 7 points you need to remember. These 7 points you need to remember about neurofibromatosis, in which Cafulet spot present in 100% of the patient. See the diagram. These are the Cafulet spot. This is axillary freckling. And this is thickened nerve, plexiform neuroma. So nowadays, trends of image-based question. So Cafulet spot, axillary freckling, plexiform neuroma. Remember these images in your mind, and those 7 features again you remember. 7 features again you remember. Those 7 features you again remember. Cafulet spot, axillary freckling, leash nodule, incidence increase with age, plexiform neuroma, optic glioma, osseous lesion, family history present, capsulate spot present in 100% of the patient. You need 2 out of 7 to make the diagnosis of neurofibromatosis. Next one is tuberous sclerosis. This is also autosomal dominant disorder. There are so many classifications, so many ways to how do you remember tuberous sclerosis. I go with my way. Infancy and older children feature. In infancy, these are the 4 features. Ash leaf hypopigmented spot. Hypopigmented spot present in the body. Infantile spasm, previously known as, now known as epileptic spasm. Subependymal calcification. What is subependymal calcification? ये ब्रेन में, this is ventricle. On ventricle lining, this tubers. Subependymal calcification. Subependymal calcification. Tuber, characteristic of tuberous sclerosis. And rhabdomyoma. What is rhabdomyoma? Most common cardiac tumor in children. It is associated 33% with tuberous sclerosis. Rhabdomyoma. So, rhabdomyoma, if you see the heart, you see some mass attached to ventricle, echogenic mass. It is rhabdomyoma. Suppose in fetus you diagnose some mass is attached to the ventricle, septum. Rhabdomyoma. Until unless prove otherwise, it's rhabdomyoma. The beauty of rhabdomyoma is it regresses with the age. And on the other side, if it's tuberous sclerosis, tuber increase with the age. Tubers increase with the age. So, if fetus is having rhabdomyoma, 33% chance is going to be tuberculosis, because in fetus you can't see the hypopigmented skin patches. So, if neurologist noted a kid with hypopigmented patches and epileptic spasm, he sent the patient for echo, whether tuberous rhabdomyoma is there. If a cardiologist see a patient of rhabdomyoma, he always send the patient for neurologist to evaluate whether it's a tuberous sclerosis, because association of tuberous sclerosis rhabdomyoma is 33% only. Okay. So, infancy mein what features present in infancy? Very simple. Hypopigmented patch, epileptic spasm, subependymal calcification and rhabdomyoma. As child grow, classical cutaneous stigma appear. What are those classical cutaneous stigma? Adenoma sebaceum, shagreen patch, subungual fibroma, retinal hematoma, renal angiomyolipoma. Yeah, I will show you the pictures. This is adenoma sebaceum. Red color nodules over face. Adenoma sebaceum. This is periungual fibroma. This is shagreen patch, orange peel consistency growth over back. Orange peel consistency growth over back, shagreen patch. And picture of echo. You are seeing here echogenic mass. This is rhabdomyoma. Image based question. Suppose they give you a picture of echo, heart, mass is there. Association of this picture is with syndrome, tuberous sclerosis. Infancy, hypopigmented patch, epileptic spasm, subependymal calcification, rhabdomyoma. As child grow, characteristic cutaneous stigma appear over body. What are those characteristic cutaneous stigma? Adenoma sebaceum, shagreen patch, periungual fibroma, Shagreen patch is a orange peel consistency growth over back. Periungual fibroma, you see here, periungual fibroma. This is orange peel consistency growth over back. This is rhabdomyoma. In the LV septum, echogenic mass is attached, and this red color nodules over face is adenoma sebaceum. Adenoma sebaceum. So this is tuberous sclerosis. This is neurofibromatosis. You again remember the 7 points of neurofibromatosis: capillate spot, axillary freckling, leash nodule, plexiform neuroma, optic glioma, osseous lesion in the form of scoliosis, sphenoid dysplasia, pseudoarthrosis, and family history present. You need 2 to make diagnosis of neurofibromatosis out of 7. One is always capillate spot. Tuberous sclerosis feature occur in infancy and older children. Infancy, hypopigmented spot, ash leaf shaped, epileptic spasm. So when I joined my MD, my senior taught me, when you take the history of seizure, just examine the skin for hypopigmented patch. If there, you are dealing with syndrome. Seizure, if hypopigmented spots are there, tuberous sclerosis. Do a MRI, subependymal calcification. Do a echo, you may get 33% rhabdomyoma. As child grow, classical stigma appear: adenoma sebaceum, Shagreen patch, periangular fibroma, retinal hematoma. Send the child for ophtho examination. Send the child for USG abdomen because kidney shows angiomyolipoma. So these are tuberous sclerosis, neurofibromatosis. We will do the question, but one word questions are also there. Most common tumor in neurofibromatosis type 1, optic glioma. Sphenoid dysplasia is a feature of neurofibromatosis. Rhabdomyoma associated with which of the following condition? Tuberous sclerosis. Infantile spasm occur, which of the following condition? Tuberous sclerosis. So you should know all these things.